If you're not a fan of Obamacare, you got your wish. With the election of Donald Trump, along with Republican majorities in the House and the Senate, there's no longer any obstacle to repealing it. But wait, what about the 20 million Americans who are enrolled in it? What happens now? Kate Flexter joins us with more. Kate.
Well, Alan, during his campaign, Donald Trump's mantra was repeal and replace. Now the big question is what that replacement looks like.
Sarasota resident Assunta Swire is one of millions covered by Obamacare. She lost her coverage 16 years ago when she was diagnosed with an autoimmune disease.
At the time, it was just extremely overwhelming. It was frightening.
President Obama's signature and controversial reform was a hot-button issue throughout the election.
Obamacare has to be replaced.
I will defend the Affordable Care Act.
A recent Reuters Ipsos poll shows healthcare is the #1 issue Americans want President-elect Donald Trump to address in his first 100 days in the White House. And he's vowed to repeal much, if not all, of the bill. In an interview with 60 Minutes just days after the election, Trump appears to hedge on the topic, though, agreeing not to tamper with certain provisions of Obamacare.
Are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period, we're going to
keep
very
that?
much try and keep that.
Until Obamacare was signed into law, Swire was very much on her own when it came to health care.
I had created a safety net for myself by being responsible and having health insurance in case of an emergency or in case of a time of crisis. And the first and only time that I ever attempted to cash in on that, they said, yeah, no, we're going to go ahead and not do that.
Under Obamacare, she got health care for the first time, just one of millions. The U.S. Department of Health and Human Services reports 20 million people have gained health insurance under the Affordable Care Act. In the state of Florida, as of March, the Obama administration reported more than 1.5 million Floridians were enrolled in marketplace plans. And census data shows the uninsured rate dropped from 21.3% in 2010 to 13.3% in 2015. While the future of Obamacare is unknown, with open enrollment underway for 2017, many are enrolling or re-enrolling.
Everyone who I see needs it. They've had it. A lot of the people that I assist are returning.
Shantae Zachary assists people enrolling in the program and says nobody seems concerned that the benefit will be taken away.
They had it before. They definitely want to keep it, and they're not worried about the possibilities of, the future of the program.
But many complain of expensive premiums, and the U.S. Department of Health and Human Services estimates a 25% increase in premiums for 2017 coverage. New College political science professor Keith Fitzgerald says it's by no means a perfect system.
By mandating to people who have modest incomes that they have to spend some of that modest income on health insurance, and then as it turns out, the lower level programs are not great, you're making a lot of people very upset, and arguably you're not really helping them a tremendous amount.
But says while many want to see the bill go, simply repealing it without a viable alternative might prove difficult.
Even people who don't like this are going to be affected if you just did away with it without replacing it. So practically, I think you have to try to replace it, fix it. You can't just wipe it off the books.
The question is what will replace it?
So now the challenge is, if you want to get rid of this thing, you're really going to have to come forward with a substantive proposal, and it will not be an easy job.
After 16 years of living without coverage, Swire says she's not concerned about losing it.
At the end of the day, you've really got to take your health into your own hands and be more responsible for it.
But she is concerned for the families that rely on that coverage.
I have a lot of compassion for those who are afraid. It could mean that life as they know it would have to change, or even more frightening, that something could potentially not be available to their child.
If the pace continues as is, hundreds of thousands of people will be enrolled in the program for 2017.
Kate, thank you.